Hi everyone, I'm Stephanie with Nine Health. Today is Children's Mental Health Awareness Day, so we're going to talk about children's mental health, especially during this COVID-19 pandemic, how it's affecting your kids. Ask us your questions. I have several experts with me. I'll introduce them in a moment. And it is Mental Health Awareness Month, so we are partnering up with the Colorado Department of Human Services, their Office of Behavioral Health, to bring you some of these segments and partner and really just deliver this information, connect you with the experts so you can ask your questions. So first, I'm joined via Zoom by Andrew Gabor first. He's Director of Child, Youth, and Family in the Behavioral Health Office. And Heather Craiglow, she's Director of the Head Start Collaboration Office for the Office of Early Childhood, all with the state of Colorado. And of course, Nine Health expert Dr. Pal Coley is joining me as well. She's a cardiologist, but also an expert on preventive medicine, internal medicine, and she's really our COVID-19 expert as well and is helping us answer all those questions. So if you have any of those questions, you can ask those too. First, Dr. Coley, will you give us an update on the COVID-19 pandemic in our state today?
Yeah, absolutely. So as of yesterday at 4 p.m., we had 17,830 cases confirmed in Colorado and 921 deaths. And since we're talking about children, I also wanted to bring to everyone's attention two studies that came out this week, both about children. The first is about a rare but life-threatening complication that is occurring in children called Pediatric multisystem inflammatory syndrome, which is essentially kind of a shock-like situation. Now, we don't know whether that's a result of the viral infection itself, because some of the kids that are actively infected with the virus are presenting with this disorder that requires ICU care, or it's a sequela of the virus, meaning it happens after the virus is resolved that leaves some sort of an inflammatory process in its wake. Similar to what's called Kawasaki's disease in children, and inflammation of the blood vessels. But we do know that kids can get pretty sick with this, and the most common presenting symptoms are fever, rash, and abdominal symptoms like nausea, vomiting, or diarrhea. So I want the parents to keep their antenna up for that. The second information that we got about children this week came from a study looking at children who are, exposed to COVID to try to see what percentage of them actually became infected. And surprisingly, the ratio was quite low. So of the kids that were exposed to adults that had COVID, only about 12% or so actually were positive for COVID themselves. And then they broke this down and looked at how many of them had symptoms and how many had no symptoms. 16% of children were asymptomatic without symptoms. And the ones that did have symptoms, the most common symptoms tended to be fever and cough, very similar to adults, but throat redness was another symptom of COVID that we observed in children that we're not seeing in adults. So some updates on our knowledge about how COVID functions in children and their risk.
Yeah, I was seeing some of those stories this week, and they are concerning, but it's good to have the information and know how things are affecting our kids as we move forward. Since this is also new, the novel coronavirus is something we haven't experienced before. So I feel we'll keep learning things as we go on. But as we're talking about kids, again, it's Children's Mental Health Awareness Day. I'm joined by Andrew Gabor, Director of Child, Youth, and Family with the Office of Behavioral Health for the Colorado Department of Human Services, and also Heather Craiglow, who is a Director of Head Start Collaboration Office of Early Childhood. My table keeps shaking and my camera keeps shaking because my 4-year-old didn't want to leave my office today. So since we're talking about kids, I figured he could stay. I'll let Macklin say hi. Hi. Say hi to everybody. Hi. So talking about children's mental health, Macklin, how does the virus make you feel? Yeah, we're not very sure. So I think, this is a good topic to talk about. It's hard to express it to maybe a child that's his age as well, a 4-year-old. I have a 5-month-old who doesn't know what's going on really, but obviously. But, today he didn't want to do schoolwork. So, I don't know when to push, how hard to push, or, if he needs to sit on his iPad for a couple hours, is that fine to help his mental health? So first, we got our update from Dr. Coley. Everyone, you can ask your questions as well if you have them. Let's just get into it though. Why is it important for children to develop these strong mental health habits? Andrew, I'll start with you. I'll let you answer that one first.
Sure, absolutely. Well, just listening to the news, it can be hard to continue to maintain or really regain our behavioral health. We've been doing this for weeks at this point. So we have to be diligent, just like maintaining our physical health. Oftentimes it takes exercise and it takes persistence and planning. Same thing with our behavioral health and with our children. They're all affected for sure. And so being diligent about that, being transparent to when you're checking in with your children about how they're feeling, no matter what age they are, and practice. Sometimes, your child might blow you off. It's okay. Maybe they're not ready to talk to you. Keep trying. And behavioral health and mental health habits are patterns. And when the pattern's broken, repeat it, keep trying, and just keep trying again, and don't be discouraged.
Yeah, and we talked before we came on, you have a 1.5-year-old, a 7-year-old, right?
Yes, I do. Yep.
How are they doing right now? How are you guys doing?
Doing okay. I mean, no one's perfect, and we certainly have our moments, but we try to find the good in the day for sure. I was saying that even my 1.5-year-old, we go on walks and he's in the stroller and everything, but when the Thunderbirds were flying over, we went to a park and he was kind of walking around for the first time in weeks, and a car drove by and he was just like, whoa. And it's like, yeah, he probably hasn't seen a car in months. Really. And so it helps to put it into perspective from their lens, for sure. Like, this is new to them too. With school ending, my 7-year-old's really struggling right now, that he's not going to see his friends for a long time. And that's a new reality for him, for sure.
Yeah, we visited some family members, and said hi to their kids that are my kids' ages, kind of through the window, and a little strange. And they kept trying to run, outside or play with each other. And so, you just have to keep explaining it. But yeah, I think they're more resilient than we give them credit for sometimes, and hopefully they'll all come out of this okay. Heather, I'll let you answer that first question as well. Just why is it important for children to develop these strong mental health habits?
Yeah, thanks, Stephanie. Mental health can be a sensitive topic, and but at the same time, it's also really important to talk about. And that's because everyone does have mental health, even babies. Stephanie, you just said you have a 5-month-old, and having that foundation for lifelong mental health is set in those early ages. And so often we focus on those physical growth and the physical development of a child, and the topic of mental health, it often gets overlooked, especially in our young children. And so with that, the children's social emotional development begins at birth, and with the relationships and those experiences that they have right from the beginning, and ensuring that we as the trusting adults in the children's life, that we have secure and loving relationships, we have positive experiences with our children, and that children develop a foundation of mental health that supports them throughout their lives. Because you as a parent, you will have that same child with you for a very long time. And I think one thing that families can do to help encourage those healthy habits in young children is by focusing on their social emotional skills. And that includes allowing your children to be with other children, and making friends, managing their emotions by labeling their feelings. And you had mentioned that your son was feeling sad today, and what does that mean? And ensuring that we label how we're feeling. And also, I think everything that we do in those early years of a child's life is based on relationships. And so exposing children to those skills, like Andrew said, just you have to keep practicing these habits.
Yeah, and relationships are really important for all of us. Dr. Coley, maybe you can just touch on, she mentioned, letting kids see other kids, but how do we do that right now safely? And maybe you can just give some recommendations as far as, we're safer at home now, but obviously still better at home, and keeping our kids away from other children and other families. Maybe you can just give some guidelines and advice for that.
Yeah, I think it's important to realize that children are not just small adults, that their social and emotional development is very different from adults, but in some ways similar. So I sort of think of it as overlapping Venn diagrams. And one of the important things for childhood development is socializing, because a lot of children learn their behaviors by emulating other children. They're stimulated intellectually to learn new things as well, by interacting with their friends. So it is important to make sure you maintain that, although challenging, I will say, because we do want to minimize the amount of screen time. But certainly virtual options, I think, are the best ones at this point to really have kids interacting. I know a lot of classrooms have gone virtual, and a lot of teachers are doing virtual educational sessions and stuff as well. But I do think if you can find workarounds to those virtual options as well, such as, getting your kid out in the backyard and having the neighbor's kid in their backyard, maintaining those social distancing, but still being able to at least visually see each other from a distance. That may also be a beneficial way to really help kids to interact. And there are many resources out there that you can also turn to. 9healthfair.org certainly has resources for adults, but if your child doesn't have a pediatrician at this time, I can't stress now more than ever how important it is to establish a primary care relationship, both for medical reasons, but also for, psychological and mental reasons, in case either of those need attention over the next several months.
And is that a starting place if your child's struggling with what you think is maybe a mental health issue, to start with their pediatrician?
that's always a great starting place, because a pediatrician is a wonderful resource to really get you plugged in to whatever it is that your child may need, whether it's behavioral coaching, whether it's, you know, medical treatment, or whether it's a combination of the two. But always have a low threshold to call your pediatrician to really, you know, pick their brain if anything unusual is going on with your child that you want to bring to their attention.
And then we're getting some comments. If you have any questions about children's mental health, even just general mental health questions or coronavirus questions, you can post those. Someone did talk about, you know, they don't think teenagers are doing very well with this at all. Her daughter had a friend tell her last week, if football season gets canceled this year, he's a high school football player, that he would kill himself. So how serious should we be taking, you know, things that are said like that? And then I'm going to skip ahead a little bit, Andrew, maybe you can talk about how the COVID-19 pandemic has affected children and teens' mental health.
Yeah, absolutely. So if someone is saying that they're feeling like they're thinking about killing themselves or they want to kill themselves, absolutely take that very seriously. Even if this is the 100th time they've said it, take it very seriously every single time. So don't shy away from that conversation. I think, yeah, teens, those youth that are coming back from college who have spent a year or two living as adults and they're coming back home and now they're living like a teenager again. It's a transition for sure. Coming home, leaving school, being locked in our homes, it doesn't feel great for any of us. And for our teenagers, it's really hard. I personally can't imagine trying to maintain like a relationship right now. I mean, I know when I was in high school, once I got a girlfriend, like you couldn't keep us apart, and now we have to stay apart, right? And so it's going to be very, very difficult. I think we can definitely identify some symptoms, and what's important to remember is that does the behavior changes, are they affecting your child negatively throughout their daily life? Right? We're all going through new changes and new emotions, but is it affecting you negatively? So if they're super bored or sad or depressed or overly worried, or with school ending and different activities, different emotions might blow back up, anxiety, depression, yeah, that feeling of suicide. I want to talk about that there's some things that we as parents can do to help minimize the impact of COVID-related trauma. And that's what it is. It's trauma. Like having school end and having the football season get canceled or whatever it might be, it's a trauma. And so we can do things like, first of all, stay calm. We're not perfect. None of us are perfect. I can speak from that. But letting your children know if they're coming to you and they're melting down or they have a grievance about you or something like that, and you're feeling overwhelmed, let them know, hey, I'm feeling overwhelmed. I need to take a minute. I need to take some belly breaths, sit down, invite them to take those belly breaths with you. That'll teach them that it's okay to calm down and before you have a conversation, right? Secondly, put yourself in their shoes. It's okay to say like, wow, it sounds like you're really upset. Sounds like you're worried. Sounds like you're sad. Or even simply, hey, help me understand what you're feeling. And ask them to help you figure out what's going on for them. You might get different responses. Like if you ask a 4-year-old, they might not know. And so having those questions, I'm like, wow, are you feeling sad? Because I'm feeling sad too. You know, the third thing is don't make assumptions about what they need. Ask them like, how can I help you? And say, I'm here for you. This really stinks. This all stinks. And that together we can work through this as a family. And then also praising those small behaviors. They're developing new behaviors. We're developing new behaviors. If your child has done something that is good, and hunt down those good behaviors and praise that. The more we are praised as people, the more likely we are to repeat that behavior, right? And then we talked about structure. It's important to maintain some level of structure. Going home and doing home-based education is so difficult because we don't have the structure that the schools have, right? They have spent years developing that structure. Kids have spent years learning that structure. And then at home, it's all different. And so we got to have some kind of a structure like bedtime routines, things like that, but we have to have flexibility and we have to build in that fun to make sure that we do actually have fun with our kids. And then also talking routinely to your kids about what's going on. Like check in with them daily, be transparent, tell them this is temporary, it's hard, this will end, and we'll work through it together. And then lastly, our number one jobs as caregivers and parents is to make sure our children are safe. So that might be wearing a mask at the grocery store. It might be asking for help, or it might even be like leaving a dangerous environment. So there's a lot of things that we can do as parents to help our children and youth out for sure.
Yeah, I liked what you said about, just kind of focusing on the emotions that we share too. Like yeah, this stinks, and I know that it does. I feel the same way as you. Let's, let's come up with ways together, maybe of something fun we can do, or something else to focus on. Heather, can you just talk a little bit about how parents can help manage their own mental health in relation to, we're sharing these same emotions, but how should parents be managing their mental health concerns while supporting their children?
Yeah, I think Andrew hit on a lot of those topics. And I think in these moments right now, when you're feeling completely stressed and you're overwhelmed, definitely taking a break and breathing is very helpful. And stop and recognize those feelings, most definitely, especially now. And information overload is real. And it's definitely okay to take a break from reading and watching the news. And know that it's completely normal, and understand on how you feel and what your emotions are. And for some families, we're working from home and we're homeschooling, caring for ourselves and others, and it's a lot to manage. So definitely taking care of your body, your mind, exercising, even if you don't have space or the equipment to do that, you can do stretches and running in place even. And your children can do that with you, practicing those deep belly breaths, most definitely, and plenty of sleep, although some of those are hard for some folks too. And then give yourself some compassion. You can say that what's happening right now, it's temporary. And Andrew said it, we'll get through this, but we have to take care of ourselves. And we don't have to be perfect, by all means, not right now. And just think of all of the amazing things that you're doing for your family and your child. You're modeling for them that you'll be resilient, and you're just building amazing emotional foundations as we're going to come out of this stronger, both mentally and emotionally. And self-care is not selfish, and it ensures that you are preparing yourself physically and mentally to care for your child.
Yeah, I think that's all important. And Dr. Coy, maybe you can talk about, you touched on the resources that we have at on9healthfair.org, but since we're talking about, parents managing their mental health, talk a little bit about the resources we have for adults on our website.
So if you go to 9healthfair.org, you'll find a really good topic library to really connect you with a lot of mental health resources. You'll also find free depression and anxiety screenings. And again, these are designed mainly for adults, so not so much for use in children, but a good, gives you a good sense of what sorts of things to look for, even in your children, things like loss of interest or excessive sleeping, or, anger, behavioral changes. Those types of things can certainly occur. But if you are concerned about yourself or your child, again, the most important resource is to make sure that you get connected with a medical professional. And there are resources to help you do that through telemedicine as well. So 9Health Fair has also entered a partnership with a number of telemedicine providers that can connect people, especially in rural parts of the state, with resources that can come to them right in their living room. So it's hard right now because there are a lot of offices closed, and it's not always easy to find a provider, but certainly that's a good place to start.
Yeah, and someone's asking on our Facebook page, just going back to, teenagers. My granddaughter was supposed to graduate this year. She was starting to struggle a bit already, but, being on lockdown definitely forced her into things more and more. And she does have a therapist, but this Sharon, she says that the phone calls from therapists are not helping. Andrew, can you talk a little bit about, if for a teen, especially if talking to a therapist doesn't seem to be helping, and then just Dr. Chloe mentioned some signs, but just talk about all the signs that we need to be on the lookout for that a child is struggling, child or teen.
Yeah, absolutely. I think it's okay to talk to your child's therapist if they and express your concerns about what's going on, what you're noticing. As a therapist, it was always helpful for me when parents would say, hey, listen, like, I know, he or she is telling you this in the room, or maybe I don't know, but this is what I'm seeing at home. And the more information they have, the better, so that they can make sure that your child is getting the right resources, and be that, maybe needs to be more intensive services for a referral for that, or even medication to kind of get us through this. I also wanted to underscore that there's the Colorado Crisis Services. Sometimes our therapists aren't available, and Colorado Crisis Services is 24 hours a day. You can text or you can talk, and you can outreach a trained counselor or even a peer. So that's an adult with lived experience. You can text TALK, so TALK, to 38255, or you can call them at 1-844-493-8255. So I think starting with that as well, and talking to your therapist, normalizing it, keeping and developing that mental health hygiene of checking in with your child, normalizing that this is not normal, that we say that this will end, but also for prom and for the football season or whatever else that might be, they won't have that again for some of our kids and youth. And that sucks. And that really sucks. And so being able to talk to you and feel that they can confide that in you and grieve that loss is okay.
Yeah, and Heather, maybe you can talk about what, additional things to do if you recognize any signs that you are concerned about. Dr. Cole, mentioned talking to the pediatrician, first. What other things you should do if you recognize the signs? And maybe Andrew talked about the crisis services line, and I'll put that information in the comments, but any other resources and programs available?
Yeah, for young children, they're not missing out on prom. However, if they do have siblings in the house, and that's a whole family dynamic. Families can reach out to trusted adults, and that does include your church or your faith-based organizations, perhaps maybe your school counselor, depending on where you're at in the development of your child, the age ranges. And something else too that we have in our state is within our community mental health centers, we actually have state-funded early childhood mental health consultants that provide free services to the adults who work with the children. And they are dispersed throughout all 64 of our counties in our state, and they can be reached through your local mental health center. And we can also put a number in the chat to have families be able to reach out to. And I think too, as a parent who also has a senior, in missing all these amazing milestones, it is grief, and it's understanding those stages of grief, because when families are able to understand that, they can also help their children process these big emotions, because they're big emotions, and I think they're even hard for us as adults. And overall, I think reducing the stigma around mental health, it really takes all of us. And the more that we can connect with each other during this time period, the stronger that we'll end up being.
You have a senior? I'm so sorry. That is so hard. Can you, I don't know if you want to talk personally, but is there anything you're doing personally to try and make this, senior year memorable? Is there anything that their school is doing?
Yeah, we're having her do some vlogging, video archiving, actually like writing. I think they're so used to electronic means of communication. They're doing lots of work connecting with their friends via Zoom, and they're super creative themselves. And she also turned 18 during COVID, and so friends actually drove by honking horns, balloons, signs, because we couldn't necessarily have a traditional 18th birthday. So I think right now, this class of 2020, they are more innovative than ever, and I really do expect amazing things from them in the future.
Yeah, they'll be in the history books. They've done things differently. It's not the same as everyone else has always done it. So maybe those are some positive ways to look at it. I had a question I wanted to ask. You were talking about, mental health development at all ages. I have a 4-year-old that we saw. I have a 5-month-old. And Dr. Cody, maybe you could talk about this as well. But someone brought this up in one of my mom groups, that they're worried about their baby, although I'm not really taking my baby out anywhere, but seeing people with masks all the time. Like, they won't realize that people have a second half of their face, I guess, or they won't be seeing those expressions. Can you talk maybe about how that affects baby's development at all? If it does, should we be worried about that?
Yeah, so we do know that social as well as medical development may be impacted if we are stuck in the social distancing phase with masks on for several months or years. At the scale that we're doing it right now, it's unlikely to make a significant impact. But one of the ways in which babies learn what laughing means, what crying means, what surprise means, is by actually looking at people's faces, adults' faces, and those expressions. But the good news is that the adults that tend to have the most impact on the babies are usually their immediate family members, usually the parents and siblings and such. So as long as there continues to be social interaction within the home, I feel pretty good that at least in the short term, it's unlikely to significantly impact their social development. But again, if you're noticing that your baby's not hitting the milestones that they should be hitting, the social smile, the recognizing your faces, then it's certainly something to bring up with your pediatrician. There's also potential impact on their immune system. So kids' immune system, as it's evolving, there's a hypothesis called the hygiene hypothesis, which is still controversial. So not every expert believes it. But the idea is that if you're exposed to germs as a child, it actually helps kind of train your immune system so that you have fewer allergies and risk for autoimmune conditions as an adult. Again, that usually requires years and years and years of being isolated and cut off. So at the scale that we're doing it right now, I don't think the impact is going to be substantial, but it is certainly something to think about. And then finally, the last kind of segment that people worry about is their educational development, because one of the ways in which educational development occurs in kids is really to be in other group settings with other kids around. And this is not just true for kids, it's actually true for teens. Even in medical school, actually, one of the ways in which we learned medicine was by bouncing ideas off of each other and working in groups. So since a lot of that has changed now, that could potentially have a long-term impact, but it's just something we have to be mindful of so that we can find, as you said, innovative ways to work around not being able to physically be present with each other, but we continue to have many of those interactions. With respect to the facial expressions, there is some data also coming out of the Journal of the American Medical Association that is suggesting that face shields may actually serve similar efficacy in terms of protecting you as face masks. We don't know yet if they protect others to the same extent from your droplets as face masks do, but they're still looking into that. But if that does happen, that could certainly be a good compromise, because when you have a face shield on, you can at least see people's faces, look at their expressions, and interact and connect with them that way.
Yeah, and my son is hard of hearing. My 4-year-old is hard of hearing in his right ear. He wears a hearing aid at school, but it's severe loss, but he can still hear and understand. But someone on Facebook posted in one of his, children with hearing loss Facebook groups, masks that have a window for your mouth. So it's like a plastic piece in the surgical mask. Is that even a real thing? Because you never know on Facebook if what you're seeing is real or not, or if it's a mocked up image. Have you seen anything like that?
I've not seen anything like that being actually studied, but certainly you can imagine the masks don't have to be, opaque masks. They could be clear masks.
Yeah.
And the nice thing about some sort of a plastic mask is that it actually can be cleaned probably a little bit easier, because you can use those disinfectants, wipes, and alcohols and such to clean them, but they haven't really been studied. So I would caution against using something that hasn't really been established or recommended by the CDC. But certainly down the line, if this starts to become more of a reality for us in the long term, I think those types of solutions will certainly help to solve the problem.
Yeah, I could just see someone that's even more hard of hearing than he is. They read lips, so if they can't see the lips of the physician or the doctor, how that works. So I thought that was interesting, but I've been wanting to ask you if that's something that even exists, and if you've ever even seen physicians use something like that. So I just thought it would. Yeah. Okay. And before we go, I did want to ask you guys and let each of you, Andrew and Heather, talk about this. I didn't touch on it, but Dr. Coley brought it up a little bit. The key milestones for children as they grow, and she talked about some of that is when I asked the question about my baby developing, those social skills. Andrew, maybe you can go first about, what are those key milestones that children reach as they grow that we should look out?
Yeah, sure. So we typically put children into different buckets. So there's the early childhood that Heather focused on, that 0 to 5. There's also 5 to 11. And then there's 12 to 18, and then 18 to 26. And we go up to 26 because we know that the brain doesn't really stop developing until around that age. And so even someone in their mid-20s, their brain is still actively growing and changing. And in each one of those buckets, there's substantial changes that happen within the brain. I mean, we can see that pretty easily if you look at a 6-year-old or a 16-year-old. Their behaviors are different, right? Because their brains are different. But if you also think of like a typically developing 15-year-old, and maybe they're hungry and they're living in COVID reality, and you ask them to, fold the laundry or set the table, then when they stress, and when any of us get stressed, we regress to an earlier developmental stage. And so that 15-year-old might be acting like a 3-year-old. And that means their brain is also hearing as a 3-year-old. So that means for us as caregivers and parents is that we need to use less words, we need to be very clear, and we need to be calm, just like if they were 3 years old. And then as they calm down and become that 15-year-old that we know and love, then having that conversation, we're like, wow, what just happened? Let's go grab a bite to eat. Let's talk about, what we can do to have a healthy life, right? in terms of resiliency, I really do see kids as like a ball of Play-Doh, where if you take a ball of Play-Doh and you chuck it against the wall and then you try to reform it into a ball, it's going to look a little different every single time. There's going to be a little different cracks, a little different shape, and every time you hit against the wall, it's going to look a little different. And that happens with us with every one of our experiences shapes who we are starting at the earliest age. And so what's important is that that child has a safe and healthy adult that can help them reform into a ball after every one of these throws. And COVID's a pretty major throw.
Heather, is there anything that you wanted to add to that?
Yeah, thank you. I would say that if you have any doubts that your child is not progressing, typically, that we actually have early intervention services and child find services. They are up and running. They did not shut down necessarily, although the way that they do their evaluations and their practices are now through telehealth. And Dr. Cooley had mentioned about telemedicines, and so that's just one thing for families to there's a resource for you. And the other thing that the state of Colorado has is our Colorado Early Learning and Development Guidelines. And the purpose of these guidelines are to really improve our family and professionals' knowledge of how a child develops. And those can be found on earlylearningco.org. earlylearningco.org. And really, when we were talking about the face masks and seeing children and how they respond to facial expressions, yeah, that is part of the first 3 years of life. Children, they definitely convey their emotions and their wants and needs through sometimes crying or cooing. And then families are also doing that serve and return with them. As children progress and grow through the preschool years, that 3 to 5 year span, a well-adjusted child, they're going to seek help from adults. They are going to engage in positive interactions with adults that they may not have a relationship with. And they're making friends, they're participating and enjoying those daily activities. And most importantly, especially now, they're adjusting to changes at home or in their child care settings. And that's that transitional pieces that we really have to be aware of. And as families, our job is to ensure that we have routines and structure, because that's when children thrive the most.
Yeah, we did get that comment from someone who's actually a preschool teacher saying she misses her kids. They have a Zoom meeting every day where they check in, but it really is good to have some kind of schedule. I tried doing that every morning, at least with my 4-year-old. Sometimes there's some pushback and he doesn't want to do it. So I just try to go with the flow. But I think having some kind of expectation of maybe we should do some schoolwork now, maybe we should do, just now we go for a walk, now we have some lunch, just some kind of schedule that they're used to having. I think that does help. We did get one question, and I think, Andrew, you could probably help answer this one. Alex said, my 10-year-old's doing better with social distancing. He had chronic migraines when he attended school, and now those are gone. He hasn't had one in the last 2 months. What does that mean? And is it tied to mental health or maybe stress levels while they're at school?
Yeah, I mean, it can. There's so many nuances when it comes to mental health. Again, I think talking to the pediatrician, my first thought is, with a lot of my clients when I was doing direct care had sensory integration issues. And when there's, a school setting is so overwhelming for kids. And so that might be part of it. We're at home, it's calmer, it's more predictable. There's not yelling and bells and, everything like that. So talk to your pediatrician about your concerns. I think that's a really cool thing that you found out, that without COVID, you might not have found that out about your child. So we can learn in this situation as well. But make sure that you do follow up.
Dr. Coley, is there anything that you would like to add to that? Just migraines that existed during school, and now that they've been home, they don't have chronic migraines anymore?
I think I would certainly echo what Andrew said, but I would also caution the parent to sort of think about if there are other potential things going on at school, like bullying or anything like that, that could potentially also be manifest through the migraine. And so it may be worth probing a little bit more as to what their day was like at school, and might help to understand why those migraines are now better at home.
Yeah, I think that's good advice. And I kept you guys a little longer than I said I would. As a mom, I just had some personal interest in this topic. So thank you for offering all of your insight and your tips and your expertise. The resources that they mentioned, I'll put those in the comments. A reminder that for adults, we have mental health screenings at 9healthfair.org for anxiety and depression. If you want to take those screenings, they're anonymous, they're free. You get connected to free virtual help if needed. And also a reminder before we go, if you have a health question, call our 9Health Neighbors line. It's 303-698-4455, extension 2005. I'll put that in the comments too, but you can leave a message and a 9Health medical volunteer will give you a call back within 24 hours. You can ask any health question that you'd like, whether it's related to COVID or not. We don't have our health fairs right now, so you're not getting those preventive screenings and those blood tests that you might usually get if you went to a health fair. So you can ask questions about preventive medicine as well. And again, that number 303-698-4455, extension 2005. So yeah, give that line a call. Sometimes it's just nice to talk to someone on the phone too if you can't get your questions answered during our Facebook Live session. So thank you everyone for joining us. We are going to sign off from here. Thanks so much.
Thank you.
Thank you.
Thank you.